AC meet. Also make sure you mention the acromion itself. So the joint is where the clavicle, so we palpate the clavicle, we come out to where the little divot is, that's the AC joint, and then the acromion is the very tip of the shoulder. Got it? Clavicle, AC joint, acromion process. We're going to go sternoclavicular joint, which is right there. We're going to make sure we do, deep in here, you're going to find the coracoid process. Okay? So on the skeleton, if you look over here, that's that one that comes out. It's part of the scapula still. It comes out in front, and it's right there. If you hit it just right, you're going to feel it. Right? So, coracoid process, it's right in there. Got it? Okay. We're going to go to, if you go back, we are going to go to the medial border of the scapula. You can feel that right there. You come down to the tip of the scapula, go around the outside, you can feel the lateral. It's tougher to feel the lateral border because we have musculature there. Definitely you can feel the medial border. Okay? Up here, you can feel the spine of the scapula. All right? That's that bony process right there. Supraspinatus sits right above that, right in that divot, right above the spine of the scapula. So spine of the scapula is bony, supraspinatus is muscular. All right? Turn around for me. We're going to find the very top point of the manubrium. Manubrium is that like almost octagon shape at the top of the sternum, right? So where your SC joints are right here, do not do the soft tissue. Soft tissue is not the manubrium. Go down to where it becomes hard. That's bone. That's manubrium right there. Got it? Okay. We're going to palpate internally, 2 fingers. You're going to find the brachial artery, which, there it is. Okay. Nice. You're going to lift up, take them into abduction slightly, and then you're going to palpate the axilla. What's in the axilla? Lymph nodes. So you're looking for any type of infection or anything like that. Greater tuberosity, bicipital groove. Okay. Greater tuberosity, bicipital groove. Okay. Lesser tuberosity. So, right here. See this? That sticks out. Greater tuberosity, bicipital groove is there. Lesser tuberosity is here. And if you look on the skeleton, you can kind of get a better view of it. But we're palpating all 3 of those. Deltoid tuberosity, so if you come down the shoulder, relax, relax, just relax. Okay. So deltoids come through here. Right about here is where your deltoid tuberosity is. And again, if you use that, think about where the deltoid tendons are going to attach. And that's where you'll find the deltoid tuberosity. Deltoids, so we're going to palpate anterior, middle, posterior, because deltoids cover the entire shoulder. So make sure you tell me anterior, middle, posterior. Pec major, supraspinatus. All right, so pec major is right here. We are only going to palpate the lateral portion of the pec major. Do not palpate the medial portion, please. Okay? All right, pec major is here. Supraspinatus, we said right on top. Find that spine of the scapula and go right in that little divot that's right over the spine of the scapula. Serratus anterior, take them into slight abduction and you're going to feel right here. On the side of the rib cage is serratus anterior muscle. These are all muscles on this side. Trapezius, remember, go kind of in a triangular shape because trapezius comes out like that and up in here. So you palpate all sections. Rhomboids are right here in between where the scapula are and the spine. So that's rhomboids right there. Biceps, triceps, you guys pretty much know. Triceps right here in the back. Turn around for me, please. Biceps in the front. Turn around again. Lats. Lats are right here. Okay, lats are big muscle. They're right here. They get smaller as they come up and attach under the shoulder. So big muscle right here, come up and attach under the shoulder. Rotator cuff tendons, subacromial bursa, anterior capsule. So for all these, we are going to pull him into slight extension. So let me do the work for you, just relax. Anterior capsule. So capsule we know is just the whole capsule that encompasses the joint, right? So this part, all around this part is the anterior capsule. Subacromial bursa, you can't really palpate because it's right underneath the acromion, but we're going to go ahead and try. Okay, so acromion process is here. We're going to palpate right underneath the acromion. All right, and rotator cuff tendons, again, very difficult to palpate. but we're going to go right in here medially inside the capsule. Okay, so capsule encompasses the whole thing. Be more specific when you do your rotator cuff tendons and subacromial bursa. We'll try to get up there and see if there's any swelling in that area right there. Questions?